Multiple sclerosis. It's a chronic, incurable, and autoimmune disease that attacks the central nervous system. It affects the person's movement, senses, and simple bodily functions. It is an autoimmune disease, which means that it is initially caused by the body's own immune system. For no known reason, the body's immune cells destroy the myelin covering that protects the brain and spinal cord, which causes a disruption in communication between the two. This also affects the brain's ability to send messages to other parts of the body, which prevents normal sense function and message control. One difficulty with MS is that no two people are affected the exact same way. The main symptoms, however, include chronic fatigue, numbness and weakness in the limbs, bladder and bowel dysfunction, vision problems, vertigo, and depression. Initially, patients suffer from muscle weakness, causing difficulty walking, loss of coordination or balance, numbness, and visual disturbances. MS affects somewhere between 1.5 and 2.5 million people globally. The disease is most prevalent among Caucasians, and women are twice as likely to contract it. Most people are diagnosed between the ages of 20 and 50. There is evidence that shows there is some sort of genetic component. Studies show that some people have a gene that makes them more vulnerable to the environmental trigger which causes the autoimmune process. Basically, genes only increase the odds by a slight margin and in no means define whether or not an individual will be afflicted. A strong, healthy, and balanced diet is the key factor in both prevention as well as reducing symptoms. Certain symptoms of multiple sclerosis can be kept under control by adopting a whole foods diet. A deficiency of vitamin D as well as B12 are seen higher in MS patients. Leading to MS includes a deficiency of these vital nutrients. Generally, whole foods are the smartest choice, avoiding high-fat, low-fiber foods. Many studies show that high doses of alpha-linoleic and linoleic acids as well as selenium and vitamin E have shown to be effective in slowing the progression and aiding in symptom control. There are also food-based therapy which is centered around the omega-3 fats, fiber, lean protein, antioxidants, and phytochemicals. Normally, MS shortens the lives of women by about 6 years and men about 11. Unfortunately, suicide is a significant cause of death in MS, especially among the younger patients. Less than 5% of the people diagnosed suffer from the severe progressive type that leads to death within the first 5 years. Thankfully, there is a lot of current research to improve the lifespan and life quality of these patients. There is still no cure, however, there are many effective known strategies that help modify the disease course, prevent it from getting worse, as well as prevent attacks, relapses, or flare-ups, manage symptoms, improve function and safety, and provide emotional support. There are many therapies that help with the symptoms and medications. Most medications are administered through an IV, however, there are some pill options. People with MS do their best to combat the symptoms through rigorous workouts and daily medication injections. Many also do their best to adopt vegetable-rich diets. That being said, some can function completely normally, while others are still in bed rest and suffer paralysis. Many times, the day is full of challenges, a side effect from the symptoms. My granny was unable to walk or speak properly. She was in an electric chair for most of the disease and stayed in an in-home hospital bed towards the end. Granny was one of the few who suffered from the progressive, severe form of MS, however she still lived 20 years after her initial diagnosis. Also, talk show host Montel Williams and television sensation Annette Funicello have and had MS.